You're watching KTN Prime. Still in the August House, Health Cabinet Secretary Mutahi Kagwe spent the better part of Monday fielding questions from the National Assembly's Committee on Health on how COVID-19 funds have been utilized in the country. The CS was taken to task over the matter, as well as KEMSA procurement that saw some of its top officials sent packing. It emerged that over 23 billion shillings have so far been allocated to the ministry for the fight against COVID-19. And as Mark Namaswa now reports, 300 billion shillings sent to KEMSA for the purchase of masks for free distribution to disadvantaged Kenyans have not been supplied 5 months down the line.
Health CS Mutahi Kagwe showed up in Parliament knowing very well that he would be facing questions about the alleged misuse of COVID-19 funds. The questioning wouldn't be easy, and Health Committee members started firing from the hip.
Does the ministry have a financial accountability framework which is linked to output and outcome?
If KEMSA has received around 2.5 billion, where is this other money? Where is it coming from?
This coming in the backdrop of the Health Ministry report detailing that some 23 billion shillings had been set aside or disbursed towards the fight against COVID-19. And KEMSA, its lead supply channel, had been fingered on corruption claims.
About how much KEMSA has received, yes, I want to confirm it does not exceed 2.5 billion shillings. So where does this other money come from that KEMSA has used? KEMSA has its own capital funds.
KEMSA is in trouble over alleged mismanagement of COVID-19 funds and resources. The CEO, Jonah Manjari, and 2 directors have been suspended. Ministry of Health says 23 billion shillings allocated for the COVID-19 effort include 16.7 billion shillings from government's internal sources, 6.35 billion shillings from the World Bank, and some 350 million shillings from Danish Development Agency Danida. But 300 million shillings was among funds given to KEMSA for free masks for poor Kenyans.
Today is 17th August. This disease, as we are seeing it, we are seeing the numbers rising. So for how long would we wait or have to wait for these masks to get to the vulnerable groups?
We're also trying to pass jobs to these people. And these masks, for example, the one that we are doing with, we were working with various institutions, including the Chamber of Commerce, identify the people who are concerned, sent cabs, so that in every county there are cabs people there.
According to Seme legislator Dr. James Nyikal, corruption and its tentacles have never been a single operation within just government operatives alone.
The bandmasters in corruption are actually in the private sector. Even when you change this stuff, you bring a new one. If that is not touched, they will train these ones.
The suspicions are part of the ongoing investigations by investigating agencies, including the anti-corruption authorities and DCI. So on that one, if you allow me, through Madam Chair, I think that is something that will come to light at some point when it is done.
Among questions successfully dodged by ministry officials was one by Sigoen Soin legislator Kipsengeret Koros on why government announces COVID-19 figures as daily tallies, yet on average people wait for a day, 2 or more for COVID-19 results after tests. Though Kenya has not yet seen COVID-19 impact